We're going to talk about some of the most common questions we get about fertility. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility.
And I'm Jamie Heinlein, nurse practitioner.
Question 1, how often should we be having sex to get pregnant?
Great question. So first, if you're checking ovulation kits, it's best to have intercourse the first day that you see that positive, and then the day after would be the most ideal.
And do you need to have sex every day?
You don't. It would be great to have intercourse the days leading up to that positive ovulation kit, maybe 2 or 3 times max around the time you're ovulating.
How do I know when I'm ovulating?
Well, a couple of ways. You could be checking with an ovulation kit. You could use an Oura ring. If you do actually see any changes, you might be looking for some super clear, thin fluids. Just think of that as like a slippery slope. It allows sperm to be able to pass through.
Is it possible to get pregnant outside the fertile window?
So it's not impossible, but it's probably not super likely. The fertile window is really going to be the first 5 days prior to ovulation, the day of ovulation, and then the day after ovulation. So those are really going to be your peak days.
And when's a good time to see a fertility specialist?
Honestly, if you've been trying and you haven't had any success, there's no specific time frame. You can reach out to fertility specialists. Okay, so how long should we actually be trying before getting help?
This is a tough question. If you look at the books and look at what the definition of infertility is, generally we say if you're younger than 35 and been trying for more than 12 months, it's time to see either your OBGYN or fertility specialist. For those who are older than 35, we say after 6 months, it's probably time to see a fertility specialist. But some of this depends on how many children you want to have when you're starting your family. And so it might make sense to see a fertility specialist sooner, especially if you're having irregular cycles or if you've had periods of time where you haven't used contraception in the past and you haven't had any accidental pregnancies.
Can you be infertile if you've already had one child?
Actually, yes, and we call that secondary infertility. So if you've already had one child and now you're having trouble getting pregnant, that's called secondary infertility. And it's in fact more common than primary infertility because age is a risk factor for infertility. And it gets harder to get pregnant as we get older, both for men and for women.
What is unexplained infertility?
Unexplained infertility can be a frustrating diagnosis, but in fact, it's a category that is misunderstood. People think that when they see their fertility doctor, that they're going to get a diagnosis and something that can be fixed. I actually tell them that's ideal to have something that's fixable, but it's not the worst scenario to get unexplained infertility because we can often help those patients conceive. Unexplained infertility means we've done all the testing and there's not a specific explanation or cause for their infertility, but treatment often works for those patients, especially if you're younger than 40. Unexplained infertility often means that there's something going on maybe with egg quality or the sperm and the egg meeting inside the body, and we can't really identify those problems with the testing that we do for our general workup.
How about stress? Does stress cause infertility?
Stress is probably not the cause of your infertility, but the things we do to manage our stress sometimes can worsen infertility. So we always want people who are under significant stress to find healthy ways of managing that stress because stress can always make any medical condition worse.
Can birth control affect fertility?
Birth control definitely affects your fertility while you're on it because it prevents you from getting pregnant. The tricky part about birth control is that, and we're talking about contraceptive pills specifically, or any kind of hormonal contraception which alters your menstrual cycles or masks what's going on with your ovaries. So sometimes that can mask what's happening to your ovarian function. What it really does is delay you from getting pregnant, and in the meantime, you're aging. So it's the aging while you're on the contraception that causes the infertility, not the medication itself.
Can irregular periods mean that I'm infertile?
Irregular cycles could indicate infertility, especially if you're not ovulating, but it's not necessarily true that you're infertile. So it definitely is one of those signs that you want to have investigated and see a specialist about.
How can I improve my egg quality?
Your eggs are cells in your body that are affected by what you ingest and how you treat your body. So eating a clean diet, limiting alcohol, eliminating any form of tobacco or marijuana products are really important. There's some supplements that some people like to try. More importantly, I'd say a prenatal vitamin with the adequate amount of folic acid and DHA is really important. And being as healthy as you can, exercise in moderation, all these things can help improve not only your egg quality, but your overall health. And one last thing is sleep. Sleep is very important with overall health as well.
I'm just curious if CoQ10 can actually change your egg quality.
CoQ10 probably is not harmful to take, and it may or may not have a beneficial effect on your egg quality.
Does the sperm quality actually matter as much as the egg quality?
It is a team sport, so both the egg and the sperm matter. We do find that increasingly male factor infertility is becoming more common, and the age of the male partner does matter. Maybe not as young as it does for the female partner, but certainly it is a contributing factor.
And what about AMH?
AMH is more of an indicator of egg quantity, not egg quality. It doesn't tell us anything about how healthy the eggs are. It just is an indicator of how many eggs a woman has in terms of egg reserve. That can be a predictor of her outcome with treatment, but not necessarily any information about how healthy those eggs are.
And lastly, is 35 really a fertility cliff?
So that's a tough question. That 35 magic number comes from an old study related to amniocentesis, not to fertility specifically. Fertility starts to decline for women as early as our early 30s. We kind of have 2 points where our fertility takes a hit. 32-ish, and then again 37. So on average, 35 is kind of a point in time where fertility declines, but it's more of a gradual decline starting as early as our early 30s, and it takes a very rapid decline somewhere around 37 to 38. So the pace actually increases in terms of egg reserve. A year in your late 30s does not equate to a year of loss in your early 30s, and the quality goes down very quickly in your late 30s as well. Jamie, thanks so much for helping me answer the most common questions that our patients asked us. If you have any questions, feel free to comment below and don't forget to subscribe.